Hello, my name is Brian Budgell and I'm a researcher at Canadian Memorial Chiropractic College in Toronto, Canada. Today we want to continue our discussion of chiropractic principles by looking at the history of our shared understanding of the autonomic nervous system. Now, as you understand, D.D. Palmer subscribed to a model of disease whereby vertebrae somehow got out of place, pinched nerves and therefore blocked nerve traffic to dependent organs, thereby causing disease in those organs. Furthermore, we understand that the nerves that D.D. Palmer was talking about were the autonomic nerves, although he would not have used that terminology. In any event, the purpose of this short introduction is to frame the question, what is the autonomic nervous system? Or perhaps, what was the autonomic nervous system understood to be in the time of Palmer? Now, these days, if you ask a neuroscientist, what is the autonomic nervous system, you may get a rather evasive answer. And this is wisely because while we now have a fairly mature understanding of the structure and function of the autonomic nervous system, we recognize that there's more to learn and that current definitions will have a limited shelf life. But if we go back to Palmer's time, the late 1800s, much of what would have been accepted as the basic principles of the autonomic nervous system could in fact be traced all the way back to Galen. Galen is sometimes described as a Greek physician, despite being born in what is now present-day Turkey, and having really established himself in Rome in the 2nd century A.D. Galen was an advocate of direct observation versus theorizing about biology, and he became famous for his dissections. Now, in Galen's time, it was not possible to conduct human dissections, and so his understanding of human anatomy is an extrapolation of animal dissections and his work as a physician-surgeon. Wisely, he did a lot of work with macaques, also called Barbary apes, recognizing their similarity to humans, and so a lot of his teachings on human anatomy have really stood the test of time. Galen published extensively, describing in great detail, among other structures, the paravertebral sympathetic chain. If you're not yet at this point in your studies, we're referring to a beautiful pair of chains of nervous tissue running down the sides of the vertebral bodies in the thoracic and lumbar spine. The chains sort of peter out in the sacral and coccygeal regions, but there are also prominent extensions reaching up into the neck. As you will be when you perform your dissections, Galen was struck by the many interconnections between the ganglia and the various visceral organs, and he concluded that this allowed for the sharing of feelings among the organs, which therefore acted in sympathy with one another. I suppose it's worth noting that Galen saw this network of neural tissues as essentially a sensory organ, or an organ for sharing sensations. Nothing much happened for the next 1,500 years, or at least nothing much happened in our understanding of the anatomy of the nervous system. Galen's conception endured until the 16th century, when a couple of anatomists, including Bartholomeus Eustachius, demonstrated that the vagus nerve was a separate structure from the paravertebral chain of ganglia. That, I suppose, was an important observation, although at the time the functional distinction between vagus and sympathetic nerves was not appreciated. Getting closer to our modern understanding, in the 17th century, an anatomist whose name you know, Thomas Willis, performed meticulous dissections of the nervous system, as well as physiological experiments. This led him to attribute a motor function, including cardiovascular and respiratory function, to what he called the intercostal nerves. He observed that the vagus nerve innervated the aorta and heart, and he demonstrated the role of the vagus nerve in modulating heart rate. He also appreciated that both conscious and unconscious impulses were involved in cardiovascular regulation. Willis's contemporary, Francis Pourfoy du Petit, demonstrated that branches from the cervical ganglia were involved in the regulation of certain functions of the eye, adding weight to the concept of the paravertebral ganglia having a motor aspect. By the way, it was a contemporary of these gentlemen, Jacobus Winslow, who in the late 1700s coined the term great sympathetic nerve for the paravertebral ganglia. and then into the 1800s when we see a blossoming of experimentation into the function of the visceral nerves, leading to a particular understanding of the importance of these nerves in regulating cardiovascular function. Experiments demonstrated that stimulation of the vagus nerve could produce a slowing of the heart or even cardiac arrest, while stimulation of other sympathetic nerves caused cardiac acceleration. And so there was a growing sense, important for chiropractic and osteopathy, that what was called the sympathetic nervous system was primarily the nervous system of the cardiovascular system. It was John Langley in 1898 who coined the term autonomic nervous system. He accepted the term sympathetic for the excitatory nerves and names the cranial and sacral autonomic nerves the parasympathetic nerves. Langley also introduced the terms preganglionic and postganglionic. This most advanced thinking about the autonomic nervous system was just beginning to circulate at Cambridge and other great centers of thinking, while D.D. Palmer was still experimenting with the basics of spinal manipulation in the small town of Davenport, Iowa. Consequently, while Palmer may have had a fairly current understanding of the anatomy of the peripheral nervous system, he had none of the understanding of autonomic function that we take for granted today. For example, he would not have understood, as Langley demonstrated, that the output of the sympathetic chain, while it appeared quite regimented, was in fact diffuse. More particularly, Palmer's idea that each visceral organ was controlled by a specific sympathetic nerve was in fact incorrect. If you have already studied this material, you will have learned about the work of Otto Lowy and Henry Dale in identifying chemical transmission across synapses, and I suspect that you already appreciate the concept of fight or flight versus rest and digest to explain the adaptive significance of the sympathetic and parasympathetic nervous systems. This was a perspective particularly advanced by Walter Cannon in the 1940s and 1950s. And then into what I think of as the modern era, we begin investigations into central regulation of autonomic function and the identification of the roles of the hypothalamus and the brainstem nuclei. The point of all of this, however, is that Palmer, in conceiving of his model of disease, and so his conception of chiropractic, had a very limited understanding of the structure and function of the very nervous system on which his theses were established. He did not understand the role of the parasympathetic nervous system at all, and he saw the sympathetic nerves as purely motor nerves, providing some kind of trophic or sustaining essence to target organs. He was a very accomplished anatomist, but could not have known about reflex physiology, which had not yet been established, and there was no understanding of the cellular nature of the nervous system or the role of central regulation of autonomic function. Like us, Palmer's understanding of the autonomic nervous system was incomplete, and so while his principles of chiropractic provide a useful foundation for how we think about health and disease in the clinical practice of chiropractic, a more complete picture is now available to us. And that's what we'll talk about in our next video. Thank you very much.